There is something about this Ebola story that many Kenyans feel does not make sense. And honestly, the more you think about it, the stranger it becomes. Because according to multiple reports, the United States has been discussing plans involving Kenya becoming a quarantine or treatment location connected to Ebola cases exposure from Africa. And immediately many people ask the same question. If Ebola is too dangerous for America, why is Kenya acceptable? Because think about that carefully. America is one of the richest and most medically advanced countries on earth. So if even they prefer not to handle potential Ebola cases on their own soil anymore, why should Kenya carry that risk instead? Especially a country that has never had a major Ebola outbreak. That contradiction is what is making many Kenyans deeply uncomfortable. And the more you examine this story, the less it feels like a simple health cooperation agreement. It starts feeling like something much bigger. Let's separate facts from rumors. Reports from Reuters, CBS, and other international outlets suggest that the United States has been discussing establishing an Ebola-related quarantine or treatment arrangement in Kenya. Some reports mention facilities connected to Laikipia. Others mention American public health personnel being involved. Officially, the argument is not America is dumping Ebola patients into Kenya. That is not how this thing is being presented. Supporters argue that the plan is about faster regional containment. The idea is that if diplomats or exposed individuals operating near Ebola outbreaks regions become exposed, they can be isolated closer to the region instead of being flown all the way to the United States. And from a logistic perspective, that sounds efficient. Shorter flights, faster isolations, and less exposure during transport. But this is where the story becomes controversial, because many people are not reacting emotionally, they are reacting logically.
That is being contained there, and obviously multiple agencies involved here are also very involved in tracking people just to make sure that nobody comes into this country that has Ebola and creates a problem for us. And we feel like we've got good efforts in place to do that, and Americans should feel assured that the president and his administration is doing everything we can to protect them on that front.
The logic creates another question. If Ebola is serious enough for America to avoid bringing onto its own soil, why is Kenya considered an acceptable alternative? That is the part people cannot ignore. Because America has world-class hospitals, advanced biocontainment centers, and specialized infectious disease units. So naturally, people ask, if even America is uncomfortable carrying this risk domestically, what exactly does that say about the danger involved? And if the risk is serious enough for America to avoid, why should Kenya absorb it instead? Consciously or unconsciously, many Kenyans hear a very uncomfortable message. This danger is too risky for us, but acceptable for you. And once people begin seeing it that way, the entire story changes emotionally. Now it no longer feels like international cooperation, and it starts feeling like an equal global risk distribution. And honestly, there's another question that makes it even more controversial. If the goal is containment near outbreak zones, would it the more logical option be strengthening treatment systems in countries already battling Ebola? Think about it. Countries already dealing with Ebola already activated emergency systems. They already accepted outbreak conditions. And they have containment zones. So many Kenyans are asking, why move Ebola-related operations towards countries that successfully avoided outbreaks for decades? Why spread the risk outwards instead of concentrating resources where the outbreak already exists? That is the part many people genuinely struggle to understand. Because Kenya is different. For years, Kenya managed to stay outside the Ebola map completely, even during major regional scares. So psychologically, many citizens feel like, we avoided this danger all this time. Why voluntarily move it closer now? And whether experts agree or not, that emotional reaction is understandable. This is why many critics online keep using the phrase buffer zone, because they feel Kenya is being positioned as a protective layer. a place where dangerous situations can be managed far away from Western population. And honestly, history makes this fear stronger, because Africa has often been used strategically by powerful countries, especially for military positioning and foreign operation influence. So now, when people hear potential Ebola-related operations in Kenya, some immediately interpret it through that larger historical lens. And whether the interpretation is completely fair or not, the perception itself matters politically. Because people notice patterns. During earlier Ebola outbreaks, infected Americans were flown into the United States for treatment. Suddenly, the strategy appears different. Now it seems closer to keep the risk regionally contained. But regionally contained sound very different depending on where you live. From Washington, it may sound strategic, but from Nairobi, it can sound like keep that danger away from us. This entire debate is also exposing something deeper inside Kenya itself. Trust. Or more accurately, the lack of it. Because if Kenya fully trusted public health systems, emergency preparedness, and let alone government transparency, this conversation will be very different. But people remember COVID-19 scandals, missing medical reports, and weak public infrastructures. So even if the operation is partly American managed, many citizens still feel Kenya will carry the consequences if something failed. And that fear matters, because Ebola is not just another disease psychologically. The word itself creates fear globally. Let's be balanced. There are possible benefits. Kenya could receive advanced laboratories, medical funding, and emergency preparedness systems. So from a geopolitical perspective, this arrangement may strengthen Kenya's international importance. But again, people want transparency. Those are not irrational fears. They are serious national questions. This story is no longer just about Ebola. It touches something bigger: global inequality. Because many Africans are quietly asking themselves, will America even agree to host a dangerous outbreak operation for African countries? Probably not. And that is where the emotional discomfort comes from. The feeling that powerful countries often expect weaker countries to absorb risk they themselves prefer to avoid. Now, whether that interpretation is fully accurate or not, millions of people already feel it emotionally. And in politics, perception matters almost as much as reality. So here's the reality. This Ebola debate is not just about medicine. It's about sovereignty, trust, and how powerful nations distribute risk. Maybe this arrangement genuinely improves regional healthcare security. Maybe it strengthens Kenya's healthcare system long term. Or maybe years from now, people will look back and ask, why was a country that never had Ebola asked to carry risks that richer countries preferred to avoid? That is the real question sitting underneath this entire story. Does the arrangement make strategic sense? Or are Kenyans trying to question why Ebola-related operations will move towards a country that successfully avoided outbreaks for decades? Comment below. And if you enjoy breakdowns like this, like, share, and subscribe.